One of the things that we identified as we were developing this new hospital is that every one of our patients, and especially their family members, really have two lives. They have the life of trying to care for the patient, and then they have all of the aspects of their daily life that they still have to keep functioning through. As we looked at the waiting rooms, we needed to make sure that we could provide a space where their other life, or their main life, if you will, is going on, that they could actually move off to a space that was functional for them. So we worked very collaboratively in all of our waiting rooms to provide spaces where someone can break loose, they can set up, have a laptop, they can connect with from a power perspective, and then also from a charging and from a data perspective, and then also from a Wi-Fi aspect to be able to tie back into their normal daily life and conduct business. The waiting area has gone over so well. I get comments weekly, not only from patients and families that are in-house, but as I go out into the community about how nice it is. I've received so many positive comments, and to be very honest, going into this project, waiting rooms were not something that we actually were focusing on or we thought would be a feature, but it has turned out to be such a major element in this new hospital. As we started into the design of the patient rooms, we wanted to make sure that the room, again, worked for our patients, worked for their families, and worked for our caregivers. So we looked at the overall zoning of the room, and we created three very, very distinct zones in the patient room. We have the caregiver zone, we have the patient zone, which is basically the patient bed and directly around the patient bed itself, and then we have the family zone. We wanted that space where the family could be close to the patient, but they were even pulled away just a little bit, so they were not, in essence, right on top of the patient. One of the things that always frustrated me was, what type of a sleeping arrangement do we make for our family members? We want something that's very comfortable, very easy to use, both for patients and for staff, and will allow someone to get a great night's sleep. But it just allows us to be that much different from our competitors and from what people think of as a traditional hospital, and gives us that little bit of an edge that we didn't have before, and provides that healing, caring environment that we wanted as a part of this hospital.